We are live.
And welcome to United Way for Southeastern Michigan's Community Roundtable, where we share important resources and have vibrant discussions about topics that matter to you. My name is Dee Dee Rogers, and today is a special day because not only is it February 11th, but it's also 211 Day. And 211 is what we are going to talk about, along with discovering how our community information exchange connects people to vital health and human service organizations. Now, a few reminders for today's discussion. We hope to have time for a few questions from the audience, so please put your questions in the chat box on Zoom or into the comment section if you're watching on Facebook. Closed captions are enabled in Zoom and Facebook Live. To turn them on, please click on the Show Captions button at the bottom of your screen. All right, for 25 years, United Way's national helpline 211 has responded to millions of requests from people seeking basic needs like food, housing, and transportation through phone calls, text messages, and web chats. 211 is a dedicated number used to respond to our community's immediate social and economic needs, and the Community Information Exchange is an offshoot of 211, connecting people to vital health and human service organizations. I'd like to introduce you to our speaker for today, who can tell us more about 211 and how it relates to the Community Information Exchange, or CIE for short. I have the absolute pleasure of introducing Esperanza Cantú. Esperanza is a senior director of the Community Information Exchange and Integration Services for United Way for Southeastern Michigan. Under Esperanza's leadership, our CIE efforts have grown from supporting a handful of partners in 2019 to now supporting multiple partners and networks in 2025. She began at United Way working in the community engagement side and has been with the organization since 2019. Welcome, Esperanza. Thank you so much for being here today and sharing more about your work and how it impacts our community.
Thank you, Dee Dee, and good morning, everyone. Like Dee Dee said, I'm Esperanza, and I work at United Way as our Senior Director of our CIE work. And I'm really happy that you're joining us to help us celebrate 211 on 211 Day. Next slide, please. Alrighty. Dee Dee mentioned the importance of 211 and the role that it plays in the community. So that's exactly where we're starting today. 211 is a free and confidential helpline where community members across the country can call, text, email, and even search for resources that help to meet people's basic needs. The Federal Communication Commission has designated the digits 211 for community information and referral services, just in the same way that 911 is set aside for emergency services. 211 is a comprehensive information and referral service that helps you find resources that can help assist you with health and human services. It utilizes both bilingual resource specialists and a phone-based translation service to offer 211 I&R in over 180 languages. In Michigan, United Way for Southeastern Michigan is designated by the Michigan Public Service Commission as the local helpline for Southeastern Michigan. And it is through the support of United Way that we support the curation of a robust database of programs available to the community. Next slide, please. In Michigan, the 211 network is really lucky to have 7 regional contact centers across the state where people are staffed to answer community members' calls. At United Way, our community care advocates, or CCAs, are trained specialists who provide information, referrals, and advocacy when people in our region need help. And in addition to our core service area of Macomb, Oakland, Wayne, and Washtenaw counties, we support community members in Lapeer County as well. Next slide, please. All right, so we've talked about 211 in the United States, in the state of Michigan, and in the Southeastern Michigan region. Now let's talk about that robust database and how it's curated. That's where my team comes in, our community resources team. Not everybody from the team is pictured here, but this amazing team of resource specialists manages information for over 1,500 agencies and over 6,000 programs, services, and resources. Each of our resource specialists is responsible for connecting with organizations in their assigned county or jurisdiction, and our specialists also attend important community resource meetings across the region to make sure they are building relationships, updating the database with new resources, and providing training and technical assistance in the ways that people need it most. United Way's ability to connect 211 callers to community resources depends upon our partners who provide critical programs and services to their clients and the general community. Next slide, please. That brings me to our 211 referral partners, hopefully some of which are in this virtual audience, who respond daily to community members who need your help. We are so fortunate to have so many organizations and resources in Southeastern Michigan. Remember on that last slide, I mentioned that we have 1,500 agencies that the resource team manages relationships for in the resource directory. That is a huge asset to build off of in our effort to connect people to services that they need. From our engagement with partners over the years, whether that is through funding relationships, mutual participation on community coalitions, and more, we know that our partners use their deep knowledge, expertise, and passion to support individuals and families as best possible. Given our relationships with these partners, we also know that things aren't easy. We know that the ALICE figures continue to rise and more people continue to need access to support around food, housing, healthcare, transportation, and more. Based on 211 data, callers' top requests are utility assistance, housing assistance, and food assistance. Through other engagement, we're also familiar with the challenges our partners have. There's a growing need to support partners' ability to connect people to services and better support outcomes. Our North Star is to support ALICE and to help people afford their basic needs. And that depends on our ability to align and coordinate as partners, share data with each other about clients and resources, and mobilize United Way's network for improved policy and greater funding opportunities in the community. Next slide, please. That brings me to our partner network, which is a network of over 700 partners in Macomb, Oakland, Washtenaw, and Wayne counties. We have a deeper relationship with these partners through funding relationships, the fact that they are in the 211 resource directory or take us up in our volunteer portal, and more. We use this quarterly convening space to discuss sector strengths and challenges, and we try and provide opportunities that we believe will be beneficial to partners. An example of this are trainings, which we try and provide around grant writing, data, and policy advocacy. We also learn from our partner network where we need to strengthen connections and collaborate more with organizations. Our relationships with funded partners, which right now is closer to 200, takes us a step deeper. And so it is with these relationships that we learn what community tables we need to be at, what new resources we need to add to the directory, what trends are going on with community members, like what are they facing in their day-to-day lives, and how we as an organization can be more responsive to partner needs. Next slide, please. So put all together, when you consider the role that we play as a 211 helpline, our community resources team and the resource directory and our partner network, in 2018, we started working toward building a community information exchange, or CIE for short, like Dee Dee shared. Called Connect for Care, our CIE is a strengthened way of working with partners. It is a system that allows organizations to share information securely and efficiently. Through the bubbles on the right-hand side of the screen there, such as shared language and data integration, partners can work together to coordinate around individuals' needs. CIEs are a great way to help different parts of a community work together, and in the long run can put us on a path to a more connected and cohesive partner network. Next slide, please. All right, we're going to show a quick video that provides some more information about what CIE can look like in the future by walking you through a story about a community member named Maya as she tries to navigate resources in the community for her and her family. All right, you can play the video now.
Communities are powered by their networks and connections. Sharing information, skills, and perspectives enables people in those communities to take complex problems and find solutions. But for organizations, there are often gaps in our communication that limit our connection to each other. And when we aren't connected, it makes it harder to provide services and care to those who need it most. For example, Let's say this is Maya, and Maya shows up to a health center, and while community health worker Alicia conducts a needs screening, Maya explains that her food benefits have recently run out. Alicia takes a few minutes to research local food resources, and after a few minutes of searching, she finds an address to a food pantry that she passes on to Maya. So Maya travels to the pantry, but unfortunately, it's not a food distribution day. So she travels home and researches the food pantry's distribution hours and compares them with her own schedule. On her day off, Maya again makes the trek to the pantry and starts another client intake process. When the pantry coordinator hears that Maya is struggling with rent, he does his best to search for agencies that could be relevant to Maya's situation. Eventually, he provides a phone number to Maya. Later, when Maya calls the number, she's asked to again share her story and personal information. Unfortunately, Maya doesn't qualify for assistance at this agency, but she's given another phone number for a separate agency that might be able to help. There is an enormous opportunity to improve the way people are connected to resources by strengthening how organizations share information. Created, owned, and informed by people and organizations like you, a community information exchange is a model first developed by 211 San Diego that helps organizations better serve people. It's not just one centralized database or a specific software. It's a unified network of partners, connected by an infrastructure that supports them and providing coordinated, dignified, and seamless care. It does so by increasing exposure of social and health services through a shared resource directory. It allows a client's profile to be matched to available services they are eligible for, enabling information sharing and managing consent to safeguard privacy. Building on the foundation of 211 and existing relationships, organizations across Southeastern Michigan are joining together to create our own community information exchange, Connect for Care. Now here's how Maya's story plays out with Connect for Care. As Alicia learns that Maya's food benefits have recently run out, Alicia can quickly search and find an eligible food pantry only a few blocks from Maya's house. With Maya's go-ahead, Alicia books a new client appointment on the spot, and Maya receives an email with the date of the appointment, along with required documents and the address and phone number of the location. And later, when Maya arrives, the pantry coordinator already has Maya's information from what was collected by Alicia. And when Maya mentions that she's having trouble with rent, the pantry staff can quickly find resources that Maya qualifies for, can see which agencies are accepting new clients, and easily send over a referral. But what's potentially the most exciting is that this is happening across the entire community, helping us understand in real time what needs exist and where networks and connections are working well. Now community members and organizations can work together to advocate for policies and resources that in turn create impact and over time change the system to be more equitable. If you'd like to learn more or join the CIE efforts, visit unitedwayscm.org/CIE.
Thank you for that video. As we work to get the slides back up, I want to share one of the things that I really love about this video on the story of Maya is that we work together with our partners to build that script, the video, and tell the story of what CIE could look like in our community. And bringing it back to 211 and our role as a United Way just shows the power of what we can work on together as a collaborative of partners, really working to try and strengthen connections between people and services in the community. Okay. At United Way, we continue to build different capabilities and work with partners on establishing more CIE connections to other resources. These are some examples on the screen of how Connect for Care can help people and partners. It can help people and partners use information from that robust resource directory, which again has a team dedicated to making sure it's updated. Connect for Care can also help screen and connect people to resources, which can help support referrals and documentation about whether people access the support they were seeking. And as a community overall, it supports our ability to provide more insight into what's happening across different programs and services over time. Our CIE team works daily with our information systems team to help develop those connections that we believe will work best for people and partners based on their needs and circumstances. These ways of engaging Connect for Care can result in the following, which we know are really critical and needed in the community: quicker and simpler connections to resources, improved monitoring and analytics, and more alignment and coordination that, when you put all together, can really help us galvanize more resources for Southeastern Michigan. Next slide, please. Here are some key actions for you in case you're interested. If you're an organization that wants to join our partner network and get connected to the 211 resource directory, please visit our Partner and Grants Hub on our website. If you want to sign up and receive more information about Connect for Care, please visit unitedwaysem.org/CIE. And lastly, look, we all need a little help sometimes. If you or someone you know needs help, please contact 211 or visit our 211 page on the website. Thank you for your time, and I hope that you've learned more about how and why 211 and its existing infrastructure around people, partnerships, and technology is foundational and critical to our Connect for Care CIE. Thank you.
Thank you so much, Esperanza. That was a lot of great information. I learned a whole lot. Man, that is so awesome. We appreciate you sharing about the community information exchange and how our community can access this resource within 211. Okay, so we have a few questions for you, of course, and for our audience watching live on Zoom and Facebook. So again, this is a reminder, please add your questions in the chat and we will do our best to get to them. All right, the first question: what can someone in need of assistance do if the 211 line is busy?
That's a great question, Dee Dee. If the 211 line is busy, which we know happens from time to time, please visit Michigan 211's website, and I'll make sure that that link is available in the chat for everybody. But at that website, you can search for community resources according to the zip code where you live. So you can search what kind of resource you're looking for and your zip code, and it'll return a list of results that should be helpful to you as you try and connect to services that you need. That should be mi211.org.
Awesome. Thank you. Thank you so much. All right, next question. How can I get my agency programs information added to the Michigan 211 database or update our information?
Great question. So anybody looking to add their programs and services information to the 211 resource directory, we love you. You help us be part of a more connected system of partners working together to try and connect people to the resources that they need. So to be supportive of more dynamic and immediate information exchange about resources, our partners at the state, Michigan 211, have created the 211 Community Organization Portal. We understand that information about community resources, it changes so quickly, and to keep up with all of these changes, they've created a self-service portal for organizations to access when they need it. So by simplifying and streamlining this process of updating organizations' information in the directory, we hope that partners will feel more equipped to update more frequently and in between that requirement around an annual review. So I'll make sure that this email address is in the chat as well, but we're always here to help partners as they try and make sure that they're doing their updates to the directory. And people can contact our team at 211 service providers at liveunitedsem.org to get some help that they need. Thanks.
Oh, that's awesome. That's great. I love that. I was just asked about how they can get added over the weekend at an event, and this is great information to share. So I will email them this information, which makes it much more easier. Okay, so I have another question. How does Connect for Care CIE work? Is it a single platform?
We get this question all the time. So Connect for Care CIE, it's a different way of coordinating and working together with partners. It is supported by technology, but not by a single system. It is supported through something called interoperability, which I know is a big word, but basically it means it makes it easier when systems can easily connect and share information with each other, regardless of what system partners or clients might be using to connect to services. So for Connect for Care CIE to work, we have established connections with Michigan 211 within United Way, like the own programs and services that we offer, and within our partner network to ensure that people get connected to those services quickly and efficiently. For Connect for Care to work, however, it doesn't just require technology. We get lots of questions about that, and that the technology is hardly the barrier. It really requires real collaboration. This means partnerships around projects, data sharing, and discussions about how to leverage those connections for greater resources. For Connect for Care to work robustly, we need relationships, and today is 211 Day. We need relationships between 211, our partner network, funders, and technology to be strong and well understood because it is all so interconnected. We need feedback loops and to be able to understand changes within these interconnected parts and how it impacts people. So, no, it is not a single platform, but really it's a more interconnected way of sharing information within a partner network so that people and partners have better experiences and outcomes in connecting people to services and care.
Awesome. That's really good information to know, and I will definitely pass it on as well. I do have another question for you. These are great questions. How can I connect to the partner network and funding opportunities from United Way?
I love this question. United Way invites partners in Southeastern Michigan. So if you're a partner and you are in Macomb, Oakland, Wayne, and Washtenaw, or if you provide services in those counties, we invite you to connect to our partner network and stay tuned for information about our spring investments and upcoming funding opportunities. You can email partner networks at unitedwaysem.org with questions, and I'll make sure that this webpage is in the chat as well. But you can visit our webpage to learn more information about how to join the partner network and how to apply for upcoming funding opportunities. Another note that I'll share here, Dee Dee, for partners who are interested is that we have webinars coming up soon to help partners understand those new funding opportunities. So please reach out as quickly as you can so that we can get connected to you.
Awesome. Thank you so much. I'm looking forward to all of that. All right. Thank you so much for joining us today and leading our communities and answering our questions about the Community Information Exchange. Our United Way team is proud to showcase one of our most innovative resources in this area. Before we close, I have a few more updates for our audience. Thank you again, Esperanza. And happy 211 Day. All right, so if you are experiencing a need, as a final reminder for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like food, warming centers, utility assistance, and so much more. You can dial 211 to get connected to resources in your area 24/7, 365 days. And you can also look for resources yourself by visiting unitedwaysem.org/211. All right, looking to make an impact? If you are looking for ways to give back and get involved, United Way offers 3 easy ways. You can volunteer your time, skills, and expertise by signing up for our volunteer portal. It has hundreds of opportunities to lend a hand regardless of your age, your schedule, or your level of abilities. The portal is at unitedwaysem.org/volunteer. You can make an impact financially by being the light that helps families meet their most basic of needs: food, housing, transportation, and move from a period of crisis to one of stability. To pitch in, you can visit unitedwaysem.org/donate. All this information will be added to the chat so you can pick up the information there. Lastly, you can use your voice and join us in advocating for laws and policy changes that create positive, lasting, and sustainable change. Sign up for alerts and get involved at unitedwaysem.org/advocate. All right, our next community conversation To be looped in our upcoming community roundtable, stay turned to our social media pages, which are shown on the screen now. You can also check out unitedwaysem.org/get involved for even more information and ways you can make an impact. Thank you to everyone who helped make today's town hall possible, and to our audience for tuning in. Stay warm and remember, united is the way. Thank you.